Hi guys, it's Dr. Mona, and today I'm going to talk about biostimulators. So biostimulators are injectables that actually stimulate your body to build collagen. The most well-known one is Sculptra, which is polyl-lactic acid. Very interesting piece of history. So this product was in Europe for years, and a long time ago, again I'm saying my age, when we had a significant problem with HIV lipoatrophy. HIV lipoatrophy is patients who had HIV and they developed this very gaunt appearance, and they didn't want people to know they had HIV because at that time there was a significant stigma around it. And so they wanted something to be able to not make them look as hollow in their temples and as hollow in their cheeks. They didn't want people to know. So people lobbied pretty heavily in order to get Sculptra FDA approved in the US, and it came over, and its initial indication was actually for HIV lipoatrophy. But if you think about it, it was used in order to help build collagen and help people fill out those areas. So it was a biostimulator and not just a filler. So that's a very important distinction. So it's been around for a long, long time. We use it in our office a lot in different ways. Sometimes I'll have patients who come in who have very fast metabolism for fillers. Maybe they're runners, they're just naturally much more skinny. And honestly, I think that I could do hyaluronic acid fillers for them, but I think that they need something that's going to do a little bit more. So Sculptra is a great answer, or that type of biostimulator. You also can use it to help build collagen and elastin, and so even one vial once a year just helps stimulate that in your skin. I love using it in the neck because as we get older, we start losing more of that collagen and elastin all over, but we see it a little bit more sometimes in our neck. And so using that in your neck is a really nice way to just kind of help stay ahead of the laxity and the crepiness that we can see there. But biostimulators are not fillers. You can use them sometimes to help mimic that, in terms of where you place it, but I really like to use them for patients who have a little bit more volume loss, who need a little bit more of a boost. And it doesn't mean that you can't use it with fillers. Well, what are some of the risks? When Sculptra first came out, the way that it was reconstituted and the way that it was injected, there were patients who had little nodules or bumps under the skin. I think that created fear, and so more and more people are afraid to use it. The way that we reconstitute it now and the way that we inject it is actually a lot safer. And I always tell my patients after we've injected them with Sculptra, I say, I want you to do the rule of 5-5-5. I want you to massage 5 minutes, 5 times a day for 5 days. And what that gentle massage does is it helps make sure that you're dispersing the product and getting it to be nice and evenly throughout the skin. And I personally don't really see nodules with Sculptra, but I think that's because of the way that we now reconstitute it, inject it, and have patients massage their skin afterwards. What are some of the other risks? Well, with any injectable, there's always risk of a bruise, there's always risk of swelling, and there's always a risk of it entering into a blood vessel, and how do we address that? So with injecting, I think the safest way to inject Sculptra is with a cannula, which is proven in scientific studies to be significantly safer than with a needle. And I like to kind of fan it throughout the skin. How long does it last? That's a question that we get a lot. So Sculptra is interesting. It's one of those products that you inject, you look good right away, but then it goes away because we reconstitute it with a lot of water. It really isn't there as a filler. So unlike a filler that you see right away the benefit of, Sculptra is something that takes 2 to 3 months for you to actually start seeing it kick in. So you really want to give it time. So how many treatments does somebody need? Well, that varies person to person. Somebody who has a lot of volume loss might need 2 or 3 sessions about 3 months apart in order to really get that benefit. Somebody else might need one treatment just once a year to just kind of stimulate collagen. Maybe somebody needs it every other year. So I think it really depends on the person and what we're doing it for. Are we doing it for volume loss? Are we doing it for just aging and collagen and elastin stimulation? So it kind of depends on what their needs are, but that's something that you can discuss with your provider. Guys, thank you very much for joining us today to talk about biostimulators. As always, ask your questions, leave your comments, and we'll see you next time.